Hello, my name is Tariq. Welcome to Valley Vets. Follow me. So the first area you come to is our exotic waiting area. We have a display cabinet. Come on down. With all of our foods, our critical care diets, our Nutriberries, little coffee table for the clients to have a read through while they wait for their appointment. All of the photos here are staff pets, and we've also got our membership plaques here for the Association of Avian Vets and the Association of Reptile Vets. We have 2 exotic consulting rooms, and if you come on through this way, I will show you those. So if we look down here, this is our back treatment corridor. Follow me. And before we get to the consulting rooms, let's have a quick look at our post-mortem room and isolation area. So you come through this little vestibule, come on in, and we have an exotic isolation ward and also an exotic post-mortem room. And inside here we have a biological safety cabinet and a microscope and a fridge. And a little sink area here. Come on back through. So we're back into the treatment corridor. These are our 2 exotic only dedicated consulting rooms. Come on and let's have a look at one. So the consulting rooms are fairly simple. We have a door there which leads to that waiting area where we started the video. We have some seats for the client, a table, a scales, a computer, some relevant exotic posters, a sink, and a whiteboard on the wall for explaining things. Come on back through. So we're approaching the main avian exotic department now. We've got some lovely posters on the wall, Amazon parrots of the world, and also cockatoos of the world. Come on through. I think let's have a look at the door. This is our exotic prep area now. This is our kingdom. Come on in, let's have a look. So Lauren, one of our nurses, is on the camera, and I think, Lauren, let's just pan around the whole room and you kind of get a feel for the space we have here. So this is dedicated to avian and exotic patients. We have 2 examination tables. Both have their own anaesthetic machines. We can use isoflurane or sevoflurane. They're all sort of set up and ready to go. We have an endoscopy unit. So we have rigid endoscopy here. We do have the option of using flexible endoscopy, and that's located elsewhere in the building, but we have our own avian exotic dedicated rigid endoscopy unit. Next to prep tables we have our consumables trolley. So this has needles, syringes, blood tubes, dressings, microscope slides, all of those things that we're likely to need when we're examining a patient. We have lots of useful bits and pieces here: glucometer, microchip reader, small weighing scales, swab, clippers, Dremel, ophthalmoscope, otoscope, and some useful instruments over there as well. Next to our prep area we have our exotic operating theatre. So we have a ceiling mounted light, of course radiosurgery, which is very useful for our avian exotic patients. And then we've got 2 medical storage trolleys which have surgical instruments, retractors, swabs, magnification, hemoclips, all of the things that we're likely to need if we're operating. And then we have 2 computers here. So we often have 2 vets working at once, and we would have one on each computer. And we have a little fluid warmer here. to keep fluids warm, ready to give to our patients. We also have a little incubator right next to where our computers are for if there is a very sort of sick bird that we want to keep warm, maybe a patient in recovery that we want to watch very closely. We have an ultrasound machine as well, just for our avian exotic use. Come on through. This is our avian and reptile ward. So immediately as you come in this ward, we've got Herptech Bavaria ready for our reptile inpatients, all thermostatically controlled and with UV lighting as well. And then on the other side of the ward we have our bird kennels. Now these kennels are all extracted, so you notice this space above the kennels. That's got an extraction unit in it, so that draws air from the kennel out into the outside world. This is an exterior wall here, and that goes directly outside. If you follow me, Lauren, can we show the hatch in the top of the kennel? Let's open this up so you can see the air is drawn up through here. And we do have the option to close these as well if we want to. We also have wall oxygen, so we can pipe oxygen into these kennels should we have a patient that has a requirement for oxygen. We also have plugs on every kennel, and we can use heat mats and heat the kennels if we need to as well. So if we come on out of here, and this is our small mammal ward. We have a computer here which the nurses use. In the UK, the nurses are the equivalent of veterinary technicians in the United States. So this is a nursing computer. If we come into this ward, this is a bit less relevant to birds, but we have kennels for small mammals. And at the end of this ward, we have some walk-in kennels for our rabbit patients. Now, sometimes if we get large birds, so for example, a few weeks ago, we actually had an emu in as an inpatient here. He was in here. Come and have a look at these kennels, Lauren, so you can see there's enough space in there for a bigger patient. And then if we come on back through. So we're outside Exotic Prep now, and I'm going to take you across to our X-ray room, which is just literally across the corridor. Come with me. This is X-ray. And it's a fairly simple X-ray setup. Come on in. We've got an anaesthetic machine, an X-ray head. That black section on the wall there is lead lined, so we're able to do horizontal beams. And we have a CR processor. And actually a picture of a bird that we were radiographing earlier on the screen. And that's the tour. I hope you enjoyed, and I hope you get some ideas or inspiration maybe for your own clinic. Have a lovely day. Thank you.